Good afternoon, everyone, and welcome back. We'll give folks a couple of moments to get logged in before we get started. All right, so it's wonderful to see so many of you back for our fourth and final session in our series on substance use and pregnancy. Today, we're going to be talking about treatment, which I think everybody will find really interesting and hopefully engaging. And I am going to go ahead and get us started. So as in prior weeks, we've got Dion Evans, and Essence Hairston may be joining us later, although has been called away for some other sort of critical clinical work. Elizabeth Johnson is here with us. I'm Andrea Knittel, and then Zakiah Stewart will also be joining us today. So here is our accreditation and disclosure statements. The continuing medical education credits are offered through the University of North Carolina at Chapel Hill. For this session, you can claim 0.5 credits. So if this is your fourth and final as well, you can claim a total of 2. We have no financial disclosures relevant to this project. And so one last time, our introductions and outlines. We are a project at the University of North Carolina at Chapel Hill, connected with UNC Horizons, which is our perinatal substance use disorder treatment program. And Justice Core is really a group of us that are providing training and technical assistance for jails specifically, as well as direct service working to identify alternatives to incarceration and connect individuals who are pregnant with substance use disorders, connect them with treatment. So today, we are going to talk about evidence-based treatment of substance use disorders. We're going to talk specifically about opioid use disorder, which is certainly, I think, at the top of everyone's mind when they think about pregnancy. We'll talk about alcohol, stimulant, and other substance use disorders, and then also what treatment access looks like in jails, and then how to refer or request technical assistance from us. So I will hand this over to Elizabeth to get us started.
Thank you, Andrea. So happy that you guys are joining us today for our final Lunch and Learn session. So when we start talking about treatments for substance use disorder, it's important to kind of start thinking about what our goals are really. And this is in partnership with the patient. So we want to be sure that we're being patient-centered and patient-focused when we're thinking about goals. And so looking at and remembering sort of the larger context of substance use disorder and that it's biopsychosocial. So we have to look at all of the realms. Thinking first physically, we want to eliminate withdrawal and cravings. This is particularly important when we're talking about opioid use disorder, but we are also seeing this in other use disorders, withdrawal symptoms in particular, and then cravings are pretty much a norm across all the use disorders. We want to be really sure that we are looking at the whole person, so addressing both the psychological and social contributors to substance use disorder. It's important, particularly when we're talking about female identifying people, the rates of trauma in this population are incredibly high, and that's an important thing to kind of file away and be aware of. So as you identify and start to address these factors, it's also real important that you treat any physical health or mental health condition that you may discover while you're talking to the person. And this may be something that maybe someone's substance use led to this particular condition. It could be that particularly like when you're thinking about mental health, whether it's trauma or some other mental health diagnoses, may actually be really closely intertwined to why someone started using in the first place. or conditions that have gotten worse because of someone's use. So these things are very closely intertwined, and so we need to start thinking about treating all of that. And so then also, real importantly, helping people think about either engaging and connecting with family or re-engaging, reconnecting with family. That's one of the highlights of a substance use disorder, particularly those that have progressed along the sort of spectrum of severity that we've talked about, is that oftentimes the people's relationships with their circle, whether it's family, friends, children, other people in their lives, have often been negatively impacted. Okay. So what do we mean when we start talking about evidence-based treatment? We're going to talk a little bit about medications, because those things are an important piece of what we're doing. But really, they're only a piece. So really, if you start to think about substance use disorder, again, on the chronic disease model, use that as sort of the way you look at it, you would not expect medication alone, for example, to take care of someone's diabetes or someone's hypertension. It's a part of the package that we have to be thinking about. So we are going to talk about medications for opiate use disorder and alcohol use disorder, but it's also real important to be thinking about substance use related counseling services, group or peer support services, housing, all the support services that someone needs to be able to be successful on their recovery path. And we can be thinking about residential treatment programs like what Horizons offers, which is one of the higher levels of care that people can access. And then some people may not need the amount of structure that comes with a residential treatment program, and may be more comfortable or more appropriately served in an outpatient program where they are going to a facility and getting treatment a couple of days a week, or maybe even up to 5 days a week, but then living it on their own in the community. So we're going to be talking about all of these different things and helping think through what might be appropriate for patients. When we start thinking specifically about pregnancy, it's incredibly important that we think about treatment of substance use disorder in pregnancy, because we know that if we use evidence-based treatments, so evidence-based treatments include, like I said on the previous slide, medications as well as behavioral health interventions, we know that we are going to be able to decrease ongoing substance use or a return to use in the pregnant person. If that person is doing better, then of course we decrease the risk of them having a fatal overdose, which then also impacts the unborn baby. We have a lot of evidence to show that just getting someone stable and into treatment increases their engagement in prenatal care. If they're engaged in prenatal care and coming to visits and taking care of themselves, then of course it leads to improved pregnancy and neonatal outcomes. So we need to be thinking about ongoing treatment, not just sort of this sort of one shot, let's get you stable on a med and then don't do anything else. It really, you have to look at the whole picture, and that is what gives us better outcomes over time. So specifically for opioid use disorder, these medications may or may not be familiar to you all. There are several medications that are approved for the treatment of opioid use disorder. Methadone has been around the longest of the three that we commonly use. It requires daily dosing. It's taken by mouth. It's a liquid. For people who are outside of the carceral setting, this is going daily to an opioid treatment program, or what people often refer to as the methadone clinic. But they go every day. And the clinics have, some have set hours that are only really early in the morning. Some have more flexible hours. It really is clinic dependent. But it is an everyday commitment for patients, which works really well for some people, and for others, that daily trip is a burden and hard for them to be able to manage. So it's something to just sort of take into consideration. Buprenorphine, which comes under trade names, like we think about buprenorphine alone, the mono product as Subutex. It comes in combination with naloxone as well. which is more commonly Suboxone. There are a couple of other different formulations as well, such as Zubsolv. But mostly oral. There are injections, long-acting injectables, which right now in pregnancy, they're not yet recommended. There are some studies going on looking at that safety, but using buprenorphine sublingually in pregnancy. One take home there is that there is still, I think, in spite of sort of the literature that's out there, there's still a lot of people who believe if you're pregnant, you have to be on the mono product, buprenorphine alone. You can't take the combo product. And actually, research over the past 10 years has shown that either one is a safe option, and really it's about giving patients choice. Naltrexone is a complete blocker of opiates, so it's available in Vivitrol. It's also, which is an injection that you take once a month. There's also oral naltrexone that we use. Neither have are not approved officially for pregnancy. There is a large research study going on in the United States right now, trying to establish a protocol and establish safety recommendations, so that the ultimate goal is that we want pregnant people to be able to have access to the medication that's going to work best for that individual, and really being able to have conversations that are patient-centered and doing what we call shared decision-making. So that allows us as providers to be able to do this teaching, and allows patients to have all the information and make an informed decision about what's going to work best for them. And then, of course, in conjunction with patients, it's real important to have behavioral health and other support services in place for all people. So there are lots of myths and truths out there, particularly when it comes to medications for opioid use disorder. Commonly, I hear people will talk about, someone's taking a medication just to alter how they feel. This can be particularly true. I know with some people who take methadone, they can be very sleepy in the morning. Part of it is just the way methadone is currently dosed as once a day. So someone may look somewhat impaired and just sleepy, but actually, they're just trying to feel and operate like every other person, that is trying to get through their day. And there is also a lot of talk about, well, I'm just substituting one drug for another. And that's actually not the case, because people who are stable on their medications for opioid use disorder, what they will say to you if you ask them is they just are able to feel like a normal person. I've had so many stories of patients coming in. I had one who came in tears one day because she was just able to go through the carpool line and pick up her kids from school, and then join the PTA and go to a PTA meeting. So just sort of the normal things of being a parent. She was real excited about being able to do. She said, I just feel normal. So we know that, medications can take away withdrawal symptoms. They can take away cravings, just helping people live their life. And so someone can really take time to focus on recovery and move away from the behaviors that surrounded their active use. And it's important to remember that medication is a medical treatment for a disease process. When we are thinking about alcohol, stimulant, and other substance use disorders that we have talked about, so there are medications to treat alcohol use disorder. In the non-pregnant population, there's a lot of question as to whether or not they are completely safe in pregnancy or while a person is choosing to breast or chest feed. And so there's a lot of question around that. We don't have as many options with people who are struggling with alcohol use disorder, and there are no currently approved medications for stimulants or other types of substance use disorders. So here we are really leaning on behavioral health. There are interventions in the behavioral health realm that we know can work really, really well with these other substance use disorders, and getting the other support services in place for people is incredibly important. I'm going to turn it over to Dion.
Good afternoon. So substance use disorder treatment in jail, things have really got better for jails. They are now incorporating the Suboxone and the methadone, and people are bringing it to the jail so these people can get it. But like Elizabeth said, even though they getting, treatment on that side, they still need, the mental health treatment. They need resources so when they leave, they can keep doing it, because you all know from working in jail, you have people that been there 6-9 months, stay clean, leave and back again in the next 3 months because we missed giving them something that they needed to go out with. So expert recommendation, people in jail have access to MOUD and other substance use disorder treatment. National Commission on Correctional Healthcare, Substance Abuse and Mental Health Services Administration, recent legal claims support that Americans with disabilities can apply to people with opiate use disorder who are denied opiate use disorder.
Great. And I am going to talk just a little bit about how that access happens. Certainly, some of you may be in facilities that transport folks daily to a community outpatient treatment program or an OTP or methadone clinic, or to a hospital. Some facilities will partner with that OTP so that either the OTP brings medication to dose individuals at the facility, or they have another setup such that they can dose within the facility. An increasing number of places are having jail providers directly obtain training so that they are comfortable prescribing buprenorphine. And I would say much less frequently, but possibly, a facility can obtain an OTP license in order to be able to give methadone directly without needing to be partnered. It's also possible to obtain state and DEA licensing as a healthcare facility, although this is also a pretty big undertaking, and I think is mostly something that has been done at the prison level, where there is sort of the statewide resources rather than county level resources. But then I think most kind of exciting possibility on this list is this last one, which is that folks who need access to treatment can be referred somewhere else, right? They can go somewhere other than the jail, because we all know, even at the prison where there are a ton of resources, it is still pretty limited what folks can access in terms of treatment. And so thinking about referring people to some other option is, I think, probably certainly the least expensive and least time intensive option, although all of these other things are certainly good ideas. I'll hand it over to Zakaya.
Thank you, Andrea. So here at Justice Core, we provide training on evidence-based management of substance use disorders and pregnancy to jails and county staff. This is actually the last training of the series. However, the recordings for these trainings will be made available to you all, and we encourage you to share this with other staff within your facility. Further technical assistance can be coordinated for training specific to or for your facility. In terms of technical assistance, in addition to these trainings, we offer technical assistance providing guidance and connections to help jails connect pregnant and postpartum people with substance use disorders to evidence-based treatment and alternatives to incarceration. And Justice Core can help by sharing resources that can provide care, and again, also identify alternatives to incarceration. And then lastly, our direct service piece. We work directly with pregnant and postpartum people with substance use disorders, as well as with jails and county staff, again, to identify and implement alternatives to incarceration. So if you have a client in your jail who you think would benefit from placement in a residential program, don't hesitate to reach out to us. I'll pass it back to Andrew.
Awesome. And I will just acknowledge one more time all of the amazing folks who have worked on this project, the Doris Duke Foundation, which provides our funding. And then I have left intentionally quite a lot of time for questions with this one, because I anticipate that there will be lots of them. And I will just leave our contact information up there. Absolutely, if you have someone in your facility who you think would benefit from being in a residential treatment program or connected with other resources, you can absolutely give us a call. And the burden for you ends there. There's really very little else that the folks on the jail end of things need to do. Essence and Zakaya and their team really picks it up from there and does the clinical assessments, figures out what level of care is right. So whether or not it's an outpatient option or a residential option. They also work with the DA and the judge and all the various legal folks, and so can help get folks access to all of those things without you having to do more than maybe lift one finger just to dial that phone number or send that email. So I would love to encourage all of you to get your questions in the Q&A. In the meantime, I have a question, I think, for both Elizabeth and for Dion. When you guys see folks who are coming out of jails or prisons and coming to Horizons, I wonder if you could share a little bit about what folks have told you about their experiences with that transition. And then also, what you've heard about what folks' experiences have been with different kinds of treatment after being in a jail or a prison.
Dion, you want to start that question? Oh, you're muted.
I work at a jail part-time, so I have referred one or two clients to Horizons. I do know that once I do get their consent and give it to Essence, it's gone. Essence does all the work. She talks to the lawyer, she talks to the inmate, she gets transportation together. It's nothing that the jail has to do but make that call. Like I said, all I did was fax it, and Essence took it away from there. And the women are very grateful, to get here. Some of them make it, some of them don't, but they're grateful to be here.
Thank you.
Thanks, Dion. And I would just add, I think that the programming that, Justice Core and then what is happening in our wake through Empower and now Grace is incredibly important, because historically what I found the biggest hurdle to a lot of the patients that were coming directly from a carceral setting was that they would lose it took time for their insurance to get kicked back in. And so being able to access medication was a challenge. And so it's really amazing to have all these supports in place to help people navigate that. But as Dion so beautifully said, we have plenty of people who do really, really, really well. They get the supports in place, they get the treatment they need, and they thrive. Occasionally we have people who don't do that, but for the most part, I think the vast majority of the people that we've had come into our residential program or we've had come to my OB clinic are thriving and doing well. And it's really a beautiful thing to see when people are able to parent their children and just get back to leading sort of a normal, boring life. Yeah.
That's really wonderful to hear. I can also say, I don't practice in a jail setting, but from the prison, we've also referred many clients, including those who have ended up in the prison through the safekeeping legal mechanism. And it is definitely the case that we do very little once we refer them. And Essence and her team really are quite incredible and can connect folks both with Horizons and then also with the broad network of pregnant and parenting programs across the state to help somebody find something that is, close to home, if that is what is best for their recovery, or far away from home, if that is what is best for their recovery, and can really help identify what resources are most useful. All right. Well, I am not seeing any questions in this moment. Y'all are unusually quiet today. Usually there are at least a couple of questions that pop up. I will give you another few moments to type your questions in, and I will just go through the process for claiming your CME credits or certificate of participation, if that is what you need or wish for. After today's session, you'll receive a link to the evaluation. We hope that you'll complete that evaluation, whether you want to claim continuing education credits or not, because it's useful for us to know how this training went and how we might design sessions in the future. You only need to complete that evaluation once. So now that all 4 of the sessions are complete, if you missed one, you will also get a link to all of those recordings. And so you can go back and watch the one that you missed and then complete your evaluation to claim credit for your 2 full hours. Or you can, there's an option as you're going through the evaluation to just check the box for the one that you did attend and that you would like to get credit for. I will also just add that if I think that we have all of the right email addresses for you, and hopefully things are not getting stuck in your spam filter. But certainly if you don't get a link to complete the evaluation, you can email Jamie, whose email address is up on the screen right now. That's the jbjack@email.unc.edu. And she can absolutely connect you with that evaluation. Similarly, if you run into issues related to getting your certificate, give us a little bit of time once you submit that paperwork. It is not an automatic system where it just sort of in an automated way gets shunted through. So give us a moment to see your submission and share it with the folks at UNC who are issuing the credits. Wonderful. Well, thank you all. I think we can go ahead and wrap up. I appreciate those of you who've posted in the Q&A that this information was useful. I hope that you will take all of this back to your facility. And please do not hesitate to reach out if you feel like, your coworkers really would benefit from this or a slightly different training. We're happy to help coordinate those sorts of things. And we hope that we will see all of your names pop up in claiming credit for participating in these sessions, and let us know if there are other kinds of trainings that we can offer in the future. So thanks so much, everyone.